Good morning. My name is Tina McCaffrey. I'm a senior analyst with KCERA. Today I'm going to represent retired employees of Kern County, also known as REOKC. REOKC is a nonprofit organization, and their main purpose is basically to safeguard the pension and health benefits for the retirees. So pretty much they're like the big brother of the retirement world. They represent the retirees on KCERA's Board of Retirement and provide different avenues of support and information for retirees and their survivors, which currently sit at about 9,000 retirees and survivors, and it's growing all the time. When you retire, a benefit packet will be provided to you. Inside that benefit packet is going to be information on the REOKC benefits, along with an enrollment form. Now, by signing up for REOKC, it will only cost you $2 a month, and it will come directly out of your KCERA pension. By being a member of REOKC, you will be able to attend the monthly meetings and the luncheons, which are currently being held at hotels. Lunch will only cost you $6 a month if you choose to have it out of your KCERA pension. If you choose to pay at the door, which you can, it's only $1 more. Where in Bakersfield can you find the lunch for $6 or $7 anymore? Now, at those luncheons, there are presentations from KCERA each month. Voya makes appearances as well as Strata, and in addition to those representatives, there's a wide variety of speakers that also attend. You will also receive a trend newsletter, and this is distributed every other month. As a member of REOKC, you are also eligible to purchase for a variety of insurances, such as dental and vision. Now, the vision plan is VSP. That is the same vision plan that you have as an active county employee. They also have accidental death and life insurance is available, travel insurance, as well as ID and legal shields, hearing, healthcare, and believe it or not, even pet insurance. Another amazing benefit of being a member of REOKC is their scholarship program. They award $2,000 scholarships to select individuals annually to be applied to an accredited trade school, universities, or college. Children, grandchildren, nieces, and nephews of an REOKC member who are in their senior year of high school are eligible to apply. If you would like more information about REOKC, you can visit their website at www.reokc.org, or you can email them at contactus, all one word, at reokc.org. That concludes my presentation, and happy retirement.
So next up, we have Jocelyn Reyes from Health Benefits, and she's going to go over all that you need to know about health insurance going into the retirement world.
Good morning, everyone. My name is Jocelyn Reyes. I'm with the Health and Wellness team for Health Benefits. So you're all here to plan your retirement, and one of the important pieces, probably one of the very important pieces, is health benefits coverage. So I'm going to give you a very high level overview of the health benefits that are available to you. You should in your packet have a retiring employee benefits planning guide. There's a lot of important information, a little bit more detailed than what I'm going to provide you up here. So I would recommend that you go through that packet. You can also visit our website. It's very easy to remember, www.kerncountyhealthbenefits.com. There's a lot of information on the website as well. I'm presenting general information, so if you have questions about your specific scenario, we can speak one-on-one to ensure that you get the information that pertains to you. So let me get to the first slide. These are important items. Generally, you're entitled to purchase Kern County retiree health coverage if you have at least 5 years of Kern County retirement service credit, and you receive a monthly pension from KCERA. Your health benefits as an active employee, they don't automatically roll over into retiree health benefits. You must request enrollment in your retiree health benefits. There's a 30-day grace period, so you have 30 days from your date of retirement to enroll in benefits, but you really want to do that about a month prior to your retirement, just to ensure a smooth transition. So you want to, I'm sorry, let me go back a minute. If you pass that grace period, you're no longer eligible to enroll. So again, you want to do that at least a month prior, no more than 30 days after. If you miss that time and you're eligible for county contributions, you will lose eligibility. And you will not be able to enroll until the open enrollment period for your benefits to be effective in the first of the year coming. So those deadlines are pretty important. Another thing to remember is that as an active employee, our benefits are bundled. You have medical, dental, and vision. As a retiree, those benefits are separate. So you can enroll in one without the other. If you want to be on medical, but you want to enroll your spouse on dental and yourself on dental, you're able to do that without enrolling your spouse in medical. They all are separate benefits. With that being said, there are also separate enrollment forms. So you'll have a different enrollment form for each benefit that you're enrolling into. So as a retired employee, you have Liberty Dental as an option for your dental. Right now, as active employees, we have PPO and HMO dental. This will be an HMO plan that you have available to you. That means that you have to receive your care through HMO Liberty Dental providers. And there's no out-of-network benefit. There's also no coverage outside of California. So if you plan on moving, this dental plan would not work for your situation. If you're currently enrolled in the PPO dental plan, like I said, that's not available to you as a retiree, but you can continue coverage through COBRA benefits. So with COBRA, you have up to 18 months where you'd be able to continue the same coverage that you had as an active employee. That is not a retiree benefit, so that would not be coming from your pension, the premium on that. That would be coming from you paying directly to our health and wellness office. So you also have available to you retiree vision coverage. That is through the state plan administrator that does our active benefits, it's vision services plan. That plan offers you routine eye exam every 12 months and frames and lens allowance every 24 months. Just remember again that this is a separate benefit than dental, so if you want to enroll, you would fill out a separate enrollment form. And again, you wouldn't have to get dental and vision. You can choose one or the other if you choose to, or both. Next, I have the county paid life insurance. So if you are a county employee in certain categories, the county is paying for life insurance for you. So if you are in management, you are getting a $400,000 policy. Confidential is $100,000, and employees represented by KCERA, KCP, KCPOA, SEIU, and SEIU CJU, you have 20,000. So if you're interested after your retirement to continue this policy at your cost, right now county's paying for it, but if you want to continue to do the same policy outside, you're able to do so. You have to do so within 30 days of retirement. For the portability and continuing this policy, you would have to contact the Guardian Life Insurance. And again, that has to be within 30 days of your retirement date. So the phone number is in your printout of the slideshow. Another benefit is the post-employment health plan. And just like the county paid life insurance, it doesn't pertain to every retiree. It is retirees in certain bargaining units. We call it the PEHP, Post-Employment Health Plan, provides a tax-free account that is administered by Nationwide Retirement Services, which can be used to reimburse IRS qualified medical premium. And how this account works is at the time of retirement, a percentage of your sick leave accruals will be automatically transferred to Nationwide to fund this account. If you're in the bargaining units that it is applicable to, that is an automatic and mandatory process. You have to allow about 30 days after your final paycheck to contact Nationwide about that account. And the Nationwide information is also on that PowerPoint and in the planning guide. So now I'm going to talk a little bit about the county contributions, and this is the amount that the county is going to pay toward your medical premiums. It's important to note that not every retiree is going to qualify for these county contributions. And these contributions are only toward your medical insurance premium. So if you choose not to get medical, you're only going to get dental and vision. It does not apply to your dental and vision. The county has both a monthly stipend and supplement program. So first I'm going to talk about the stipend. The stipend is the amount the county contributes to assist in lowering the cost of your medical insurance. To be eligible, you must be a county retiree and not a special district, have not opted out of the supplement program, and choose continuous medical coverage with the county at the time of retirement. If you terminate from retiree coverage or elect to re-enroll at a later time, you must be re-enrolled in a county medical plan for 3 consecutive years before you will become eligible for this benefit again. If you're only covering yourself on the medical insurance, the stipend is $39.75. If you're covering 2 parties, so you're covering yourself and a spouse, it is $53.69. And if you're covering a family, it's $61.50. And that rate stays the same. So 2 years from now, it's not going to be any higher than what it is now. The other county contribution is the Retiree Health Premium Supplement Program, RHPSP. This is also a contribution that the county will make toward your medical insurance premium in the form of a monthly supplement. To be eligible for the supplement, you must enroll in county medical coverage at time of retirement in most instances. Again, like I said, everybody's situation is different. So that's why I point out in most instances. You have to have at least 20 years of qualified continuous service working for the county, not a special district. Take active retirement from service. So if you leave the county and you defer your retirement for a later date, you forfeit that supplement benefit if you would have qualified. You must be at least 50 years of age at the time of retirement, but not older than 64, because that benefit goes away on the first of the month in which you turn 65, which is your Medicare age. You have to have contributed by payroll deduction during the qualified years of employment. If you opted out of the program, you'll not be eligible for the stipend nor the supplement. On this slide, it shows the different bargaining units and which supplement values pertain to those bargaining units. So if you notice, the value of the supplement is based on your years of service. So you have to have at least 20 years of service. If you have 25 or more, that's when you get the full value of that supplement. So how it works, and some people don't understand that even if you have 21.95 years of service, you will not get the value at the 22 years, it's still 21. The benefit is fixed at the time of retirement, and again, it will end on the first day of the month in which you turn 65. And so retirees have many plans to choose from, whether you're over 65 and Medicare eligible or under 65. A lot of people ask me which is the best plan. There really isn't a best plan. There's the best plan that works for your health conditions and the services that you need, and also for your financial situation. So what we do on this slide is we're giving you an annual plan cost comparison. So in this, we're comparing 2 of our under 65 plans, the Kern Legacy Classic Choice and the Kern Legacy Match Choice. And it's best to look at your savings over an annual view rather than your monthly, because then you really see what you're saving going from, maybe a plan that has a bigger network that you might not be using versus a plan that only has a Kern County network. You're saving a lot of money, you're getting everything you need on that plan. So that's why it's good to look at it on an annual perspective. So in this plan, we have a 1-party classic choice and a 1-party match choice. Both of those plans are Anthem plans. And it shows with the full value of the stipend and supplement, what the cost would be. So you see how classic choice after, a full supplementing stipend is $1,918. We also have the max choice, $418.18. So depending on which plan you choose, if you choose the max choice plan, it would be a $17,000 saving, almost $18,000 saving. Some of these plans that have a co-insurance, so Max Choice is one of those, where on some of the services, you share 20% of the cost. And I don't know if you guys know already, because you're already on some of these plans as active employees, but there's out-of-pocket maximums on all the plans, and that's really important when you have a plan where you share a percentage of the cost. An out-of-pocket maximum is the most that you're gonna pay. So if you have co-pays, you have that 20%, every time our claims administrator processes a claim, they take that amount that you owe and they hold that. I call it in a bucket. Once you reach that 5,000 for the year, you're not gonna have any more out-of-pocket costs, and that will reset in the next year. So that's something good to know, because sometimes when you see plans that have a co-insurance where you owe a percentage of the cost, it gets scary because you don't know 20% of what. It could be 20% of $1 million if you're in a car accident and end up in the hospital. But that is a protection for you, so you know you're never gonna owe more than that annual out-of-pocket maximum. And that is different than a deductible. So if you're on a plan that has a deductible, the deductible is the amount that you have to pay before the plan begins to cover services. So then every time you go to the doctor and we process the claim, we're gonna process it at our contracted rate. If you haven't met your deductible, what we would normally pay, you're gonna pay until you meet that deductible. So when you're looking at the plans, that's the difference between a deductible and an out-of-pocket maximum. So I did talk about COBRA in the beginning for those of you that want PPO dental, but only have that HMO available to you. So I'm gonna go over COBRA a little bit more. COBRA is a federal law. It requires us, the county, to provide you with continuing coverage on certain separations from the county. So retirement is one of them. So if you retire, you will, once your active benefits terminate, you're gonna get a notice in the mail, a COBRA notice. And that notice says that you're able to use your COBRA benefit. You can elect benefits for yourself, for your children, for your spouse. And you would pay a percentage of you pay 102%, I believe, for the COBRA premium. So as an active employee, we're paying a percentage. You would pay 102% with your COBRA benefit. Again, that's not a retiree benefit. It's a benefit of being an active employee and separating from the county. So that would not be a pension deduction like your retirement benefits. You can do that up to 18 months. After the 18 months, you would no longer be able to continue COBRA coverage. So where that might be beneficial to you is maybe if you have a child that you're not going to be covering under your retiree benefits, you have up to 18 months to cover that child if you were already covering them as an active employee. And also for that PPO dental, if you choose to be on that PPO dental. I see other people using it when they don't qualify for county contributions and they have another plan in mind, but that plan maybe isn't going to be available to them till the next year. And they can get on COBRA for up to those 18 months. We are, by we, I mean, the county health and wellness department, we are the COBRA administrator. And again, you'd be paying us directly for any COBRA premiums. So that was the end of my presentation, but I did want to go over a few important points. So if you or a spouse are 65 or older, you are required to get Medicare Part A and Part B in order to enter onto our retiree health benefits. So if you are currently 65 or older and you're an employee and you haven't applied for Medicare, you want to do so about 2 months prior to your retirement. Some people wait till the last minute and that's more hurtful than helpful. So make sure you do that timely. And you would do that not with us. We cannot counsel on Medicare. You would do that through the Social Security office. Retiree open enrollment is typically held at the same time as active employee open enrollment. So this year it's October 7th, I believe, to November 8th. And at that time, you're able to make any changes, and just like when you're an active employee, changes will become effective the first of the coming year. If you're planning on covering a dependent child, it doesn't work like it does when you're an active employee and you could cover them up to the age of 26. You're able to provide coverage for them, but between the ages of 19 and 22, they would have to be certified as full-time students. Once the child is 23, they're no longer eligible to remain on Kern County retiree coverage regardless of their school status. So our office is located on the east side of this building by the class stores. I encourage you to review the packet that we gave you, the planning guide, as well as the website. And then if you have further questions, you need to pick up an enrollment form, you want to sit one-on-one with me, you can always do so. Just come down to our office. We don't make appointments, but if you want to meet with me directly, it's always good just give me a call to make sure I'm there when you come down. But we can sit one-on-one, and that's a really important piece. It makes you feel better about the choices you're making, because I know it could be scary when you're retiring and everything's changing. So I'm more than willing to sit down with anybody and look at each situation, and we can talk about the benefits available to you, fill out your enrollment forms. Just again, make sure that you do it timely. We do have people coming at the last minute, and that could prevent you from possibly enrolling if you come in too late, or you've not applied for Medicare timely and you're not going to be eligible for Medicare until after that 30-day grace period. So you want to make sure that everything is done timely for this benefit coverage. So if you have any additional questions, again, we're located right here on this side by the Mechanics Bay Arena. I don't know, do I have time to open up for questions now? Okay. Any questions that I can help you? Yeah. Yes.
You mentioned earlier about if you had to defer the retirement and you return, is there a difference if you return in 1 year, as far as consecutive years of service?
I believe, Maka, so if they defer their retirement, a deferred retirement regardless of time would disqualify them for their supplement, correct? Yep. Correct. Yes.
Is there a place online that we can look at different services that the different insurance covers? Like a POS will cover this much of an MRI, but how much of an MRI will like a max plan cover?
Yes, we have summary charts, and one of those, well, we have a very brief summary chart available in your planning document. But also online, there is a plan document, and that plan document describes our 4 self-funded plans. We also have summaries available for some of those over 65 plans. So there is a lot of information for you online. And then if you still need more, or you want to ask about specific services, I would encourage you to call our department. I think sometimes people don't know how helpful health and wellness can be. We have a lot of information in our departments and have been working for the plans for quite some time. So I suggest that you come in and ask whatever questions you need, whatever help, we're here for you guys. Any other questions? Yes.
If you opted out of the health plan, I was told that those funds go into another third-party account and that you're eligible.
So it depends on your bargaining unit and what was negotiated. So if you were a part of the bargaining unit that if you opted out, there were funds available to you, you would have to meet with me. I would have to do a little bit more searching because there are things that could make you ineligible. But you could potentially be eligible for money after you retire that can be used for specific services. So if you were one of those opt-outs, again, I would encourage you to contact our office so we can see what is available to you based on your bargaining unit. Yes.
I'm not sure if you said that for the medical benefits, do any of them work outside of California, and does BSP work outside of California?
Yes, BSP does work outside of California. Liberty does not. And there are plans that do work outside of California. So on an under 65 plan, we have two Anthem plans. It's Kern Legacy Max Choice and Kern Legacy Classic Choice. Both of those are Anthem plans, so they are available nationwide. On the over 65, we have two Blue Cross supplemental plans. They're supplemental plans to Medicare. It's a Blue Cross Silver and a Blue Cross Gold. They would also be available to you outside of California. Any other questions? Yes.
The only thing is when you have to do with some conflict and,
If you're outside of California?
no, I mean, in general, I mean, are those the only?
No, there's multiple plans available. So if you're under 65, you have the Kern Legacy Share Select, Kern Legacy Network Plus, Kern Legacy Max Choice, Kern Legacy Classic Choice, Kaiser, and HealthNet. If you're over 65, you have a few options. Let me see if I remember them all. You have Kaiser, you have Blue Cross Senior Secure, you have HealthNet, HMO, there's a HealthNet POS plan. What else? The Blue Cross Silver, Blue Cross Gold, did I miss any? No, and all of those are available to you. If you look on the back of the planning guide, we have all the over 65 and the under 65 plans listed for you. Where you have limited options is in your vision and dental. You only have ESP available through our office. You also have your dental, the HMO dental. So the supplement you can use on under 65 plans. The only time that those would be applicable to the over 65 plans is not everybody that has Medicare due to age. Some people have Medicare due to disability. So if you are Medicare eligible under 65 and you do choose one of those Medicare eligible plans, your supplement will be applicable to those plans. However, once you turn 65, that first day of the month that you turn 65, you'll no longer be eligible for that supplement. Yes,
What is the fixed percentage of funds to set plan?
I'm sorry, go ahead.
What is the percentage used to fund the test account?
So the percentage depends on your bargaining unit. It's negotiated, so I would have to look at the bargaining unit and that would tell me what percentage of your accrued sick leave goes into the post-employment health plan. Yes.
I guess federal employee. Would it make sense to me to mine or stay on his?
So that would depend on your needs. Maybe he has benefits that work better for you. It would be dependent on you. If you are like double covered, if you're a retiree and you're covered under your spouse, the plan that covers you as a subscriber would be your primary insurance. And the plan that you are dependent on would be your secondary. So it would depend on which plan you choose. There's something about retiree benefits is once you're on retiree benefits, you're able to leave benefits at any time. If you choose to disenroll, it'll be effective the first of the month following your submission of your enrollment and disenrollment form. You just can't come back to the county at any time. If you wanted to come back onto benefits, in order to do it outside of open enrollment, there's specific permitting events. But you can leave at any time. Where you want to be careful is if you're eligible for a stipend and supplement, like a supplement, if you choose to leave, depending on what situation you're in, it depends what type of insurance you're getting, you could lose your contributions. You'd be forfeiting that benefit. So if you have decisions to make, I would always contact our department so we can kind of go over so you know what your options are and you don't make a decision and lose something that you would have never lost if you would have gotten the information you needed. Any other questions? Yes. I'm sorry. Yes, so on the over 65, there are advantage plans. With the advantage plans, if you choose one of those HMOs, that becomes your Medicare plan. So you don't have Medicare primary and let's say Kaiser secondary. That Kaiser is your Medicare plan. That is your advantage plan. Then we have supplementals, and supplementals are the Blue Cross Gold and the Blue Cross Silver. On those plans, Medicare is your primary and that supplemental is your secondary plan. We have the Gold has prescription coverage, the Silver does not. If you choose the Silver plan, Medicare still requires that you have prescription coverage, so you have to purchase a Part D, which is the Medicare prescription drugs outside of the county. Yes.
Supplemental year, does it count by that kind of just active years?
There's actual years, there's certain years that we don't consider in that, so if you had extra help time, military service, other public service, that time is not counted, so it would be your continuous years of service within the county. And we aren't calculating that, we get that information from KCERA. Any other question? Yes.
Is there, and if you've already talked about this, I'm sorry, I
It's
missed
okay.
it, but is there, if you are a management or mid-management employee and you have a payout of sick time, is 25% of that taken and put in some account that pays your premiums and stuff?
Yeah, so that was the, let me go back to what I'm sorry. So that's the post-employment health plan. And if you are management or mid-management, those are some of the bargaining units that are eligible for that post-employment health plan. I don't know the percentage offhand, but yes, that money does get transferred to an account upon retirement with Nationwide, and you can use that money on IRS qualified medical premiums.
So to find out specifics about how that works, how you use it, how long you have to use it, would it be nationwide that I would
Yes,
call? Okay.
yes, we do not administer that benefit out of our office.
Okay, thank you.
Any other questions? So afterwards, if you have questions, we are available. We have full staff of people there. I'm often there all day today. So I encourage you to come down to Kern County Health and Wellness if you guys have questions or want me to go over your specific situations. And I really appreciate your time. This was my first time doing this.
Once again, my name is Sherry Willard. I'm the Deputy Chief for the Member Services Division at KCERA. So I have been with the county for 20 years. All of that has been with KCERA. And that means that I know. That means I am actually eligible to retire now as well.
No, ma'am.
I am not.
No, ma'am.
Don't make an after this. I'm not leaving anytime soon. So I had no idea what retirement was when I started 20 years ago. And fast forward, and this is, fantastic. You've been, 10, 15, 20 years, 25, some of you probably right at 30. So you have worked really hard for this. And this is a great benefit, a great gift to yourself, retirement for all the years that you put in, all the hard work. So my job today is to go over the retirement and hopefully make it a lot less stressful for you when the time comes for you to fill out those retirement papers and get those submitted to us. So let's get started. So today I'm going to go over a wide variety of things. Purchasing service credit, how that impacts your pension, reciprocity, when you're eligible to retire, your pension benefit itself, the options that are available to you when you go to submit your retirement application packet, the benefit estimate. So I'm going to briefly go over when you run an estimate in the member portal and what that looks like, and a couple of things just to clear up for you guys. Divorce and retirement. This is a really important one, so I will touch on this as well. Getting your ducks in a row. I still have chickens. I don't have ducks yet. They're still running wild, so you want to get your ducks in a row. the retirement application packet itself, and final details of things to keep in mind. Now, who's ready to retire? Not really, not yet, I'm not ready yet, but you know all of you guys are, so let's get going. All right, so as you know, what is KCERA? It's the Kern County Employees Retirement Association. Now, we are a defined benefit plan, not a defined contribution plan. So what's the difference? Defined contribution plan is gonna be VOID, deferred comp, or IRA, 401k, something that you voluntarily put money into, and you could eventually outlive those monies in that account. Whereas KCERA is a defined benefit plan. Your pension is going to be based on certain items, specific factors. Your age at retirement, your years of service, your highest monthly average salary, and the benefit tier that you're placed in. Now, the biggest difference is that pension from KCERA is going to be paid to you for the rest of your life. You are never going to outlive it. Even if it's only $100 a month, you're going to get that every month for the rest of your life. And that could potentially leave a continuance to a minor child or your surviving spouse, or if you choose a modified option, to leave that continuance to someone else, such as sibling, parent, older child, whatever the case may be. And I'll go over options a little bit later. All right, so this is a big one. This is one of the ways that you can actually enhance your pension. Is the only way, enhance pension is you put in your 80 hours, you get your service credit. You work and you build that up, and then here we are 20 years later and we're ready to retire. Purchasing service credit will add service to your years of service, therefore increasing the pension that you're going to get. Now, you can't just go and buy any type of service, it has to be eligible service. So if you had extra help time, if you previously worked extra help or per diem, if you wanted to purchase your waiting period, that waiting period is your hire date to your entry date into KCERA. Those are always going to be two different dates. They will never be the same. Even if you purchase that waiting period between those two dates, your entry date and your hire date will still be two different dates. But that waiting period is purchasable. It can be anywhere from 1 day to a full biweekly. Medical leaves of absence. So if you were out on a medical leave for you yourself and you went without pay, you could purchase that time back. Personal leaves, family leaves. So if you were off for baby bonding, or you were off, caring for a family member and you went without pay, that's not purchasable. That's just a personal leave without pay. Now, purchasing prior county or district service is going to go towards your eligibility for retirement, and it's going to go towards your vesting. All of you here, you're already vested because you got your 5 years of service. So 5 years, that's your vesting point. So purchasing this service will go towards that retirement eligibility. It does not go towards any other benefits through the county though. So it won't go towards your seniority for vacation and sick leave. It doesn't go towards your health insurance either. Okay, just like Jocelyn was talking about. Now, the other type of service that you can purchase is prior public service. This is if you worked in another government agency, such as like the state of California, or if you were working for the city of Bakersfield, or federal government. If you were in the military, you could purchase that service credit in our system and increase the pension that you're going to get. Now, purchasing prior public service, the difference between purchasing public service and county district service is going to go towards your vesting and eligibility for retirement. Public service will not. All it's going to do is enhance your pension once you've met that criteria to retire. Okay, so if you purchase 4 years of military time, when you get ready to retire, if you had 20 years of service, your pension is going to be based on 24 years. But that 4 years of military time isn't going to get you to your eligibility. Okay, and you have to meet that in other ways. And then same with prior county district service. Public service is not going to enhance any other benefits, only going to enhance your pension. Now, there is an FAQ, as I mentioned, in the display pieces in the back. If you have service that you are interested in, if you know that you have service to purchase, you can get one of those FAQs. You can also get that FAQ on our website or in the member portal. And purchasing, if you have service to purchase, you do have to be registered for your member portal because you have to run that estimate for the purchase in your portal. Now, your member portal is like linked to the, excuse me, is linked to the pension system that myself and my staff have access to. That's what we use to calculate your pension. We keep everything, all of your information is uploaded into our pension system. Your portal is basically like a mirror of that. So when you run estimates in your portal, the information, the benefit amount that it's showing you is gonna be the same that my staff would get as well if they ran that estimate for you. So for the purchase estimate, you run that estimate through your portal. It's going to give you an estimated amount, and it's gonna tell you the lump sum service. It's gonna tell you payment options, whether it be lump sum, payroll deduction. And if that purchase is doable and you go, yes, I can do this, I wanna pay for this, I wanna do this, you still have to submit an official request form to KCERA. Now that request form, you can get it off the website, but it's also in the member portal as well. Once you submit that to KCERA, then our staff will process that. We're right at about, 30, 60 days. And when you get the final election form sent to you, it's gonna give you a due date down at the bottom. If you do not get that election form signed and submitted to us before that due date, then it's gonna have to be recalculated. And the reason is interest is accrued every 6 months. So every 6 months it gets more expensive. So when it comes to purchases, you do not want to procrastinate. It's not your friend. The payment options that you have with your purchases, as I mentioned, you can do payroll deduction. You can do lump sums. You can write a check, renew cashier's check. You can use vacation sick leave accruals. I will tell you the one thing with the accruals, if you use those, the way the county does it, they're going to tax. They're going to calculate the monetary amount of your accrual balance. They're going to tax it 42%. Whatever's left is what's available for you to use. So definitely think about that one. Me personally, I like the option of doing the deferred comp rollover because you're going from tax deferred to tax deferred. But the best part is deferred comp is a defined contribution plan. The plan that you could potentially outlive, right? You're purchasing service credit with KCERA. You're increasing your pension. So you're investing in yourself. You're rolling monies from a plan that you could potentially outlive. You're rolling it over to KCERA to increase the pension that you're not going to outlive. So that way, in my mind, I like that one better. That's how I'm doing it. But it'll have when you receive that information, it'll give you all the options. Reciprocity is another great benefit for members if it's applicable to you. So what is reciprocity? It's basically a link between most California governmental agencies. So for instance, if you work for the city of Bakersfield, their retirement system is CalPERS. And we have a reciprocal agreement with CalPERS. So if you worked for them for a couple of years and you left your funds in service on deposit with CalPERS, and then you came to work for Kern County 20 years ago, and you didn't realize that you established, I don't know, I left my funds there, I still get a statement from them. Check and make sure that you could establish, if you establish reciprocity with us. Because what that's going to do is, even though you only have a couple of years with that reciprocal system, you obviously wouldn't be eligible for a pension with just a couple of years. But if you establish reciprocity, you now got that link between those two agencies. And when you get ready to retire, your years of service with KCERA will go towards your eligibility investing in that other system. Just like however many years you have with that reciprocal system will go towards your eligibility for retirement with KCERA. And the best benefit is we're going to share salaries. So if your salary with us is higher than the salary you had with that reciprocal agency, we're going to share salaries. They're going to use our salary to calculate that pension. So you get 2 retirement checks, one from us, one from them, and they're going to use our salary to calculate that benefit. So even if you were making, 3 times less than what you're making now, they're still gonna use this salary to calculate that pension. So any government agency within California only, San Diego County, Los Angeles County, Tulare County, give you different ideas. You can go to our website. We do have that list out there. If you aren't sure whether you've established reciprocity, if that might apply to you, most definitely reach out to our office. You can email us at that member services on that business card that's in your packet. You want to make sure that if you are reciprocal, when you get ready to retire, you have to retire concurrently. You have to retire on the same day from both systems in order to keep that benefit. So that means when you get ready to retire and you're submitting your retirement application packet with KCERA, you need to make sure you contact your reciprocal agency, submit your application packet with them as well, because you definitely don't want to lose that benefit. When can I retire? Everybody wants to know when. Well, you obviously are eligible to retire because you're here. So regardless of whether you're general or safety, minimum 10 years of service and minimum age 50 in order to retire. Now for general members, and this is very rare, but for general members, 30 years of service regardless of your age. I've had one unicorn in my entire career, and she was 48 and she had 30 years of service. And that was because way back when she was in high school, she worked it's called the CETA program. And she worked that CETA program during summers and stuff. And then she worked extra help. And when she turned 18, she had started with the county. She purchased all of that time. So when she hit 30 years of service, she was only 48. She went ahead and retired. So yeah, it's very rare. That's rare. That's a unicorn. Safety members, 20 years of service regardless of your age. So it's not uncommon for me to have a 48-year-old safety member retire because they've already got their 20 years of service. 70 years old, doesn't matter how many years of service you have. And I've actually had a couple of 70-year-olds retire with only 2 years of service. So that is possible. Now, your earned service, your purchased county and special district service, and then reciprocal service goes towards that eligibility. How is it calculated? This is a big one. I don't know. How do you calculate it? Blow it out of the sky. Figure it out. All right. First, you need to know. Yes, ma'am. That means you have 8 years of which county and community work with another reciprocal agency. That now you have 9. So her question was, she wasn't sure how the eligibility worked with the reciprocity. So if you worked for the city of Bakersfield and you had 2 years of service with them, you left them, you started with the county, and you have 8 years of service with the county so far, and you're already 50, the 2 years of service that you had with the city, with the reciprocal service, will go towards your eligibility, towards that 10-year eligibility that needs to be met. So since you've already got 8 years with the county, 2 years with your reciprocal service, you now have your 10-year eligibility met. And you're already age eligible, so you could technically retire at that point in time if you wanted, and you get 2 checks. One from the reciprocal agency for the 2 years, and then one from us for the 8 years that you had. Is that help? All right. You're welcome. Okay, so first you need to know what tier you're in. We have 2 different divisions, if you will. You're either general or you're safety. Now, safety members, pretty much you're going to know if you're a safety member. We've got our sworn in officers, fire, sheriff, probation officers, criminal investigators. So you pretty much are going to know if you're safety. The rest of us were general members. So know which division that you're in. You're either general or safety. And then you're either tier 1, tier 2, or tier 2 PEPRA. Now, as you can see, tier 2 and tier 2 PEPRA, the only thing that's different is that PEPRA piece. And I'm going to hop over to my next slide and I'll come back to this one. The difference in PEPRA and what we call legacy, the tier 1 and tier 2 legacy. So the difference is PEPRA when you retire, your, final average compensation is gonna be based on your highest 36 consecutive months of salary. Whereas legacy members, the tier 1, tier 2, it's gonna be based on the highest 12 consecutive months of salary. Also, there are special pays that are not pensionable for PEPRA members that are pensionable for tier 1 and tier 2. Now, when you go in and you run an estimate on your portal, and you're looking at that benefit amount where it's showing the salary, and I'll show you in a few more slides, it will show you all the special pays that are being comprised of that benefit, of that average, that 12 or 36 month average. It's gonna list out all those special pays and it'll tell you whether they're pensionable or not in there. There's a couple of other differences in PEPRA and non-PEPRA, but these are the two main ones. You can also find a list out on our website. If you just go to the search bar and just type in special pays, that's really the easiest way. There's a full list of all of the special pays and it'll break it down whether it's pensionable or non-pensionable for PEPRA and non-PEPRA. So tier 1, tier 2, tier 3, or excuse me, tier 2 PEPRA. Who will inherit tier 1? Oh, nice. Quite a few of us tier 1. We have tier 2, couple of tier 2. Okay, so I'm going to explain this on tier 1. Well, no, let me use tier 2 because my example is tier 2. So let me back it up. I apologize, but it's the same idea. What does 1.62% at 65 mean? That means if you retire at 65 or older, you're going to get 1.62% for every year that you have in KCERA. For tier 1 members, if you retire at 60 or older, you're going to get 3% for every year that you have with KCERA. Now, if you retire under that age, if you're 50, for tier 1 people, if you're 50 and you're retiring, it's going to be less than the 3%. It starts at 2% and it increases. For tier 2 members, the same thing. You can retire at 50 if you've met that eligibility. It's just going to be lower than that 1.62%. Now, the dates that I have here prior to 10/27/07, depending on your bargaining unit, those dates may be a little different. So if you go to your portal, it's going to tell you if you're a PEPRA member, if you're tier 1, tier 2, but most of you probably already know by now. So safety members for tier 2 safety, it's actually not 2 at 50. It actually maxes at 2.62% at 55. Not sure why it's called 2 at 50. Rolls off the tongue a little bit nicer, I guess, but it's 2.62 at 55 for you guys. So how do we calculate that? For this member, Mr. Jones, he had 25 years of service. And real quick, I'm going to point out, I realized last night I made a typo in my slide here. At the very bottom, I have 40.54%. And then on the next line, I have 48.64. It's 40.54, so I apologize. So my apologies, my bad. So Mr. Jones is retiring. He's got 25 years of service and he is 65. So he is going to get that maximum 1.62%. We take that 1.62% times his 25 years. Mr. Jones is going to be entitled to 40.54% of whatever his final average salary calculates out to. And so if his salary, hypothetically, let's say it calculates out to $6,000 a month, he is going to be receiving $2,432 approximately gross every month. That's his base pension. And that will be paid to him for his lifetime. And that doesn't include COLAs and stuff like that. Okay? Yes, ma'am.
What if you qualify for the 2 tiers? Tier 1 and tier 2?
So our question is, what if you qualify for the 2 tiers? The system will calculate that difference. So if you are retiring at 55, or let's say 60, if you're tier 1, you're retiring at 60, then obviously your tier 1 piece is going to be calculated at the 3%. And then the years that you have on the tier 2 is going to be calculated a little bit lower than the 1.62. So the system will calculate that out. separately. And then it will combine it for one pension check.
Thank you.
Absolutely. All right, so who can read that form? No, I'm just kidding. I can't even read that, and I'm right here. That's the 20 years, ready to retire vision. This is a matrix that we have in the back of our handbook. You can find that out on our website. This one is running about page, I think 26, give or take. We have one out there for tier 1, general tier 2. We have safety tier 1, and we also have safety tier 2 out there. Now, the reason why I'm showing you this is a fantastic tool for you to use, because there's some members that know, I want to be at X percentage when I retire. I mean, obviously, we want to know what the money, amount is, right? We want to know what the dollar signs are. But there are some members that know, I need to be at 85% of my salary when I retire. This matrix is a fantastic tool for that, in conjunction with using the estimator in the portal. What you do with this is you find your age going horizontally, your years of service vertically on that far side. You match them up, and it will tell you what percentage of your final average compensation you would be entitled to or eligible for when you get ready to retire at that point in time. And then you can just follow it diagonally as you get a year older. Just keep tracking it diagonally, and it'll show you that increase in your percentage. So this, in conjunction with your estimator on the portal, is just a great way for you to get a good idea of where you're at, where you're going to be with your pension. Retirement allowance options. When you get ready to retire, in your retirement packet, you are going to need to choose what option you want at retirement. Now, when you choose that option, once you retire and you sign those final papers, not the application packet, but the final papers after your final paycheck, after that retirement date, your election is irrevocable. When you retire, you cannot change your option. So it's really important to make sure that you know what option you're going to choose when, and you're sticking with that when you sign those final papers. We have the unmodified, option 1, 2, 3, and 4, and then we have an enhancement, the temporary annuity option. Now, I'm going to briefly touch on each of these and go through them with you. The unmodified option, this is the most common option. This is usually the one most people choose, and the reason is this is the maximum benefit to you, regardless of whether you're married or not. It's going to give you the maximum benefit possible. If you are married or a registered domestic partner, it will leave a 60% continuance of that benefit to your spouse or partner for their lifetime, should you predecease them. Now, the great thing with this is it's going to leave that 60% continuance to them, and you are not going to see a reduction in your pension. So that's a really good option there. That's a 60%, and you're not taking a reduction in your own pension. Your spouse or registered domestic partner must be named as your primary beneficiary. Now, prior to retirement, you have to be married or registered for at least 1 year prior to your retirement date in order for your spouse or partner's age to not matter. If you get married after retirement, your spouse or partner must be minimum age 55, and you have to have been married at least 2 years at the time of your death in order for them to be eligible for that 60% continuance. So if you get married 3 months before you retire, that age 55 in 2 years is going to apply to them, okay? The continuance to minor children, if you are not married and you have a minor child, minor being they are under the age of 18. Once they turn 18, they are considered an adult, and that would not apply to them. But if you are unmarried, you have a minor child, and that's not stepchildren. It has to be legally adopted children or your biological children. If you pass away with no spouse, then your minor child would be entitled to that 60% continuance if you don't have a spouse or registered partner. they would receive that continuance until they turn 18 or 22 if they're enrolled full-time in school. And all of this information is out on our website in more detail as well. But this is the most common option. Now, if you are married, there's only two options actually available to you. That would be the unmodified and option 2. So unmodified is going to leave that 60% continuance. You're not going to have to take a reduction, and I'll pop back over to option 1, but option 2 is going to leave 100% continuance. So this is going to, if you choose option 2, it's going to be a lower monthly amount to you, but it's going to leave 100% continuance to your designated beneficiary. So one of the things with this, you cannot change your beneficiary for any reason after retirement. So if your beneficiary predeceases you, you cannot name anybody else. Your benefit will not go back up to that higher unmodified amount. You are locked in with that lower option 2 amount and with that beneficiary, okay? Real quick, to give you an example, I had a member who he wanted to name his fiance. They had been together for, a handful of years. He wanted to name his fiance, choose option 2. And about 1.5 years after he retired, he came in and wanted to change his beneficiary because she had left him. And unfortunately, there was nothing that we could do because it is irrevocable. So my point of that story is, if you're choosing option 2, be very mindful of that. Just keep that in mind. Let's see, option 1, let's go back here. Option 1 is, there's no continuance on this. It is a slightly reduced amount to you, the member. This is the only option that's going to allow you to name your estate. This one's very rare. Most people don't choose this one. Basically what this does, so when you retire, like I said, your contribution balance, your pension is not based on how much is in your contribution balance. It's based on those 4 factors we talked about. But we use your contribution balance to fund your pension. So when you retire, if your pension is $1,000 a month, $1,000 is going to come out of your contribution balance every month until it's depleted. Once it's depleted, your pension's not going to stop. That's where the county picks up and continues to, or the district continues to pay that amount, and you get that pension for your lifetime. We use that contribution balance first, and then that's when the employer will pick up and continue to pay. With option 1, it's a smaller amount. It doesn't take the full pension amount. It takes what we call an annuity amount, and it reduces the contribution by this smaller annuity amount. So that way the contribution balance is spread out longer, if you will. So typically the option 1, that contribution balance would be spread out 10, 12 years, give or take. With the other options where we use that full pension amount first, you're looking at a few years. So if you choose option 1 and you name, let's say an adult child, but when you pass away, you've already depleted the contribution balance. The only thing that would be paid out to that beneficiary would be potentially the one-time $5,000 death benefit, because we've already used up those contributions. So you took a lower benefit amount and it didn't really leave anything additional. So one more option for you, really think about if this is something that might apply to you. And our staff at KCERA is more than happy to, go into these options with you in your personal situation. So if you're not sure which one you want to choose, contact our office, speak to one of our analysts, and they can most definitely go through this with you. But option 1's very rare. Most people don't choose it. But like I said, it is the only one that will allow you to name your estate. So if you don't have a beneficiary, have someone to name, and you only have an estate, and it has to be a true legal estate. Okay. Option 2 we talked about. It reduces the amount to you. Now, the amount that it reduces is going to depend on, everyone's different, but it's going to be based on the beneficiary's age. So if they're younger than you, so if you're naming an adult child and they're 20 years younger than you, keep that in mind, because your benefit's going to be reduced it could be, quite a bit reduced, for the younger the beneficiary. Option 3, this is one of our other modified benefits. Now, this one is not available to married members, and the reason is unmodified is given a 60% continuance. Option 2 would be 100%, you take that reduction. Option 3 is a 50% continuance. So this is going to lower your monthly benefit as well. And once again, the benefit, that reduction, if that beneficiary is a lot younger than you, then you're gonna see a pretty drastic reduction in your benefit. It's gonna leave that 50% continuance. And once again, the beneficiary cannot be changed for any reason. So if they predecease you, you cannot name anyone else to receive that benefit, okay? Option 4, this one's a little unique. So once again, this would be a lower monthly benefit amount to you. This is similar to option 2, where it's gonna leave 100% continuance, but you can name multiple beneficiaries. Whereas with option 2 and 3, you only could name one beneficiary. With this one, if you wanted to leave a continuance, let's say you had 2 adult children and you wanted to leave the continuance to them, then you could choose option 4. It's gonna lower your monthly pension, and then it would leave 100% continuance split amongst those beneficiaries. And it would be whatever designation you choose. So if you like one kid more than the other and you want to go in 75-25, you can do that. Such a horrible place to be in. But you can do it. You can, but you can choose whatever percentage that you want on that. And then if something happened, once again, just with option 2 and 3, you can't change your beneficiaries after retirement. You're locked in with the beneficiary. In addition, if something happens and one of these beneficiaries predeceases the other, the surviving beneficiary will not absorb the deceased beneficiary's percentage. Okay, so that amount goes away. And when this happens, your benefit doesn't increase. So these are the risks that you take for choosing one of these options to leave that continuance for that lifetime of that beneficiary, okay?
Miss, what's an insurable interest?
Insurable interest, oh, that's a fun one. Someone that, you couldn't name someone that, like a mailman. It has to be someone that is insured in your life. So child, sibling, parent, family member, if you, even a stepchild, they would have an insurable interest in your life, caring for them, providing for them. Mailman, different stories. They don't have an insurable interest in your life unless you're financially supporting your mailman. All right, temporary annuity. This one gets people a little bit confused. So, as a KCERA member, for all the county anyhow, you are integrated with Social Security. So what that means is that you're paying into Social Security. There is an integration factor that will come out of your retirement. And what that does is that means that when you get ready to retire, because you're paying into Social Security right now as an active member, when you get ready to retire, you can draw your pension from KCERA. And when the time comes and you start drawing your Social Security, you can draw your Social Security in addition to your pension, and neither one will be reduced or offset by the other. Good deal. State teachers, they don't have that. State teachers don't pay into Social Security, so they aren't integrated. So they don't get that benefit like you will get that benefit. So the integration is a great thing, that little bit that you're paying, but it's going to allow you to be entitled to that full Social Security amount. Okay. For the temporary annuity option, this is an enhancement. If you are under the age of 62, you can choose to take the temporary annuity option. And basically, it's a way to level out your income into your retirement, taking into account your Social Security. So we would have you provide us with a statement from Social Security telling us, this is how much this person will receive at age 62 if they retired at age, let's say you're retired at age 55. They retired at age 55 with 0 future workable earnings, At age 62, their social security would be X amount. We will provide you an enhancement of a percentage of that social security amount at 62. So let's say, for instance, social security is gonna give you $1,000 at 62. And you decide you wanna take the temporary annuity option. You're retiring at age 50. Based on your age, we can enhance it or loan you approximately a third. So let's say 33%. Because of your age, it would be about 34%. So we're gonna loan you, enhance your pension by about $300 to $400. We're gonna give you that extra every month, but on your 62nd birthday, we are gonna permanently reduce your Kern County pension by not just the $300 or $400 that we were enhancing your pension by. We're going to reduce it by the full $1,000 that Social Security is going to be paying you at 62. The reason is because it's leveling out your income, taking into account that Social Security. Now, it can be a gamble, it can be a risk. I recommend, if this might pique your interest, contact our office, speak to one of our analysts, and make sure that you really fully understand it, because they can look at your pension, we can run estimates and give you a better idea of, based on your age, how much, would it be, etc.
I have a question.
Yes,
If I can ask.
yes, absolutely.
I'm retiring, 1 month before my 62nd birthday, so I don't care about the annuity, that's like, whatever, who cares? Will my, social security benefit be full, or will it be reduced if I do not get this annuity?
So her question is, she's gonna retire a month before her 62nd birthday, and she wanted to know, she's not gonna do this, definitely wouldn't benefit her. If her pension or Social Security would be reduced. And your pension will not be reduced, and then your Social Security will not be reduced because of the pension that you're getting from KCERA. Now, I can tell you that if you've purchased service credit with KCERA, and when you start to receive your Social Security will question that. And because of the purchase amount, any purchase of service, they may possibly reduce your Social Security by an amount because of a purchase of service. But every person's situation is different. So I highly recommend you contact Social Security and speak to them about that. But as far as your base pension, it will not be reduced. And your Social Security will not be reduced because of your base pension.
Okay, great.
So the temporary annuity, it can be kind of risky. Typically, I see it when members are having a hard time covering the health insurance up until 65. So they'll take this extra, but the reduction that you're going to take, the hit, if you will, when you turn 62, it really can reduce your benefit and put you in a pickle at that point in time, especially if the Social Security, if it gets reduced in the future, something happens, Social Security goes down, we still are going to have to reduce your pension by whatever that amount was that we originally based everything on. If you are applying for a disability retirement or you have a disability retirement pending, this option is not available to those who are applying for disability or receiving, planning to receive it or getting ready to receive a disability retirement. All right, so yes, ma'am.
So let's say we decide to take the cow option and we still, get another job, have different employment where it would exceed our future earnings, of what we originally had in that Social Security account. Would you still go back and reduce that based on the original estimate, or do you consider those future earnings where it would be a higher estimate than what was originally?
So her question is, if she took the TAO option and she ended up getting a job after retirement and she was still contributing into Social Security, would we adjust any of our figures? No, we would not. We wouldn't adjust anything on our end, but what that's going to do, it could potentially increase the amount that Social Security is going to pay you. But as far as KCERA, we based your pension and the temporary annuity amount on those figures at that time when you retired, and that's gonna be locked in. You're welcome. All right, so the estimate review. So when you go into the member portal and you run a retirement estimate, you plug in your retirement date. On the next screen, it's gonna ask you about the salary to use. And I wish I would have done some slides on this, and I apologize that I didn't. But it's gonna ask you on the salary. You can override and plug in a salary, or you can leave it blank and let it default. If you leave it at default, it's going to use the salary, the highest monthly average salary that our system has for you. Because our system is gonna have all the way up to your most recent paycheck, and it's going to calculate what your highest monthly average is, and that's what it will use. So if you leave it at the default and let it run its course through the estimate, this is basically what you would be looking at for information. It's gonna show you your name, it's gonna have a benefit amount, it's gonna have a death benefit amount, and then it's gonna also have option 2 on there. If you're married, it'll show option 2. If you're not married, I believe it shows option 1, if I remember correctly. One of the things I really wanted to point out to you is on the death benefit amount on this screen. That does not necessarily mean it's a given that your beneficiary is going to get a continuance if you've got, let's say, a sibling named, and you run this estimate, you go, well, look, it says on the unmodified benefit that my sister Joe is going to get that $1,500 continuance if I die. This is only going to be, the continuance would only be if it's a spouse or registered domestic partner. So it's still going to show you that amount, because the unmodified option is the only option that's going to allow you to change your beneficiary after retirement. So if you're not married and you have your sister Joe named as your beneficiary, she's not going to get a continuance. She would just get, if you have her down for the $5,000 death benefit, she could get that. But say after retirement, you end up getting married or become a registered partner, you're going to update your beneficiary to your spouse or partner. And now your spouse or partner would be eligible for that 60% continuance that's reflected here, as long as they meet that criteria at the time of your death. So just kind of wanted to point that out, because I know that confuses a few people at times. Up at the top, when you look at your estimate, you've got the options. So that's the pension options. It's going to show general, service, and earnings. That service screen is going to show you what your service credit with KCERA is up to whatever that retirement date was that you used when you started running that estimate. It will also, on the earnings screen, it's going to show you, like I talked about before, your final average monthly salary. So if you're a legacy member, just a tier 1, tier 2, it's going to be your highest 12 consecutive months. So it's going to show that period. It's going to show all the biweeklies, and it'll average it out for you. And then it's going to show you all the special pays that are comprised in that monthly average in that whole period. If you are a legacy, if you are a PEPRA member, it's going to be 36 months. And the same thing, it'll have all of that same information broken down for you, okay? So I highly recommend going in and running those estimates for retirement if you haven't already done so. And on your age, one of the things I wanted to point out, it goes on quarters. So if you're gonna retire at 55, if you're, whether you're tier 1, tier 2, you're gonna retire at 55, but hey, let me look and see what it would look like if I retired at 55 and a quarter or 55 and a half. It isn't a whole lot, but it is a little bit. And so you can do those numbers and see what it would increase every quarter that you get older. That pension will increase a little bit. So on the age, it's always on quarters until you hit that max. All right, death benefits. This is the sensitive one. Yes, ma'am.
I was unclear what you said on the unmodified option 1. Did you say you had to be married?
No, the unmodified option, you do not have to be married. That's the most common one. And if you are married, then it would married or a registered partner, it would automatically leave a 60% continuance to your spouse or registered partner. But if you are not married and you're choosing the unmodified option, whomever you have named as your beneficiary would not get a continuance. They would just get that final what we call pro rata amount at your death. So if you passed away on the 10th of the month, they would get those 10 days that you were living, that you would have gotten, those 10 days that you would have gotten. And then they would get the $5,000 death benefit if applicable, if you had them down as the beneficiary. And then if you had passed away prior to your contribution balance being depleted, if there was any monies left in that balance, that would be paid out to them as well. Okay. Yes, ma'am.
The 1.62 at 65, does that percentage change if you're say 3 months shy of 65? Does it prorate down or?
So her question was on the 1.62% of 65, does that percentage change if you are under 65, even by a few months? And yes, it does. So it will not hit the 1.62 until you hit 65. It would be 4 3/4. So even if you're 1 month shy of 65, it's still going to base it on 64 3/4. You're welcome. Okay, so death benefits. Sensitive subject, I know, but it's important. So this is one of the reasons it's really important to make sure that you have your beneficiaries, you keep your beneficiary current and up to date. Whether you're an active member or retired member, as you've seen when Jocelyn did her presentation, there is, a hefty life insurance that can be paid out to your beneficiary that you have named. In addition, as an active member, there's substantial benefits that can be paid out from KCERA to your beneficiaries as well. So really important to make sure that you keep those beneficiaries current and up to date. When you retire, the death benefit is going to be based on the option that you choose, that you chose at retirement. So whether you chose the unmodified, if you're married, registered partner, it would be that 60% continuance. Or if you are not and you're single member, you choose that unmodified, then it would not leave a continuance. If you chose option 2, you're leaving 100% continuance to an adult child or something. The death benefit of $5,000 is paid out. You don't have to have the same beneficiary for your option that you choose at retirement. So the unmodified option 1, 2, 3, 4. You don't have to have the same beneficiary name for that $5,000 death benefit. It can be whoever you want. So you can have your spouse for the unmodified option and then name your kids, split it. If you've got 2 kids, you can split it 50-50, that $5,000 for them. However you want to do that, our staff at KCERA can most definitely help you answer any questions if you have concerns on how to divide that up, if you will. That $5,000 death benefit would be paid out to retired members only. So if you passed away as an active member, that would not be paid out. One of the things on that $5,000 death benefit is it's only paid by the last California government or California county retirement system that you retired from. So what I mean by that is if you retired from Kern County, from KCERA, but then you go and you are working for, let's say, Ventura County, and you end up working long enough with Ventura County where you're now going to be getting a pension from them. You pass away, Ventura County is going to be paying that $5,000 or whatever their death benefit is. Ventura County is going to pay that death benefit. KCERA will not pay a death benefit because you have the last county system that you were in is paying that. So just something to keep in mind. And then, let's see, as I mentioned, the continuances already, so we've already got that. All right, here's the sticky one, divorce and retirement. All right. So if your wedded, marital, blissful life turns not so blissful, and you are separated, going through a separation, divorce, or you have been divorced, it is extremely important that you make sure that KCERA gets a copy of your divorce documents, your full divorce document packet. Your pension with KCERA is considered an asset and it is subject to community property. So that means that your former spouse, if you were married during your career and you're divorced, your former spouse could be entitled to and eligible for a percentage of your pension. I know, sticky. I didn't write the law. So if you are already divorced, and you are not sure that you have provided KCERA with a copy of your divorce documents, please make sure that you contact us so that we can make sure that we have those. You can email, our office and we can, check on that. You can contact us. You can come down to our office and bring us a copy of those documents and we'll make a copy. But we definitely need to have those. If you are going through a divorce or if you're separated and you're, potentially going to be going through a divorce, our legal team will do a customary complimentary review of the draft divorce documents. So that way they can make sure that KCERA is listed properly in those divorce documents and that what is being divided is something that we actually can abide by, that it is something that we can follow through our retirement law. And it is really truly best for the legal team to review those documents before it gets submitted to the judge to have him sign it and him or her sign it and finalize it. Because if for some reason in your divorce documents, KCERA was listed as CalPERS, or you didn't even list KCERA in there, you just like, I'm not gonna say anything, they're never gonna know. We're gonna know, trust me, I got an entire team of Sherlocks, they're gonna know, they're gonna figure it out. But you don't wanna have to go back to court and get that amended, so your best course of action is just to hit it up front, make sure that it's addressed beforehand and before it's finalized. If you are retired, you submit your retirement packet and we find that there is a divorce in there and we don't have those documents, we cannot place you on retirement payroll. Funds cannot leave KCERA until that divorce has been reviewed and assessed and signed off by our legal team. So it's really important that you get that taken care of sooner rather than later. So that's one other thing where procrastination is not your friend. We talked about purchase as a service. Interest is posted every 6 months, but also with divorces, you don't want to procrastinate because it could take some time for them to do that review. And if it's something that you have to go back to court, you don't want it to hold up your pension. Yes, ma'am.
So what happens if you've been divorced longer than you worked at the county? Are you
So our question was if you've been divorced longer than you worked for the county. So if you were divorced prior to when you started the county, then that's not community property. It's only if you have been divorced or separated during your career. So if it's prior to when you started with the county or special district, that doesn't apply to us. That was finalized before then. It's not community property. Yes, ma'am.
So, how do you decide if you were divorced and then you get married, but the divorce is deceased?
So her question was if you're divorced, but and you're now remarried, but the first or your first spouse that you divorced is now deceased. We do, if it was during your career, then we still need the divorce documents. We'll need to also get a copy of that death certificate and our legal team will still need to review that. Yeah, very important that they get those. I would highly recommend making sure we get that a lot as soon as possible so that they have time to really review that for you. I thought I see one more.
So, what if you were divorced prior to county service, but you have 6 years of military time to purchase to add to your overall retirement with the county? If you purchase that military time back, will that cause an issue where you would have to offset your current pension with the ex-spouse?
So her question was about having a divorce during your career and then purchasing military time. There's a lot of stipulations to that. And each situation is different. It's also based on what's in your divorce documents. So I would recommend that you contact our office and speak to someone in our legal team. I've got their information on the back page of the PDF for my presentation is legal@kcera.org. You can reach out to them there. That would definitely be something specialized that we would need to look into for you. All right. So Divorce documents, very important. If you've had that divorce during your career, make sure that KCERA gets those, because we don't want your pension held up. We don't want to not be able to put you on payroll. That hurts. It really, truly, it hurts our heart and makes us sad. So please make sure that you get that taken care of long before you're planning to retire. And right here is backwards. There we go. legal@kcera.org. There's their information there. All right, so 6 months prior to retirement, what should you do? Besides throwing a party? Get your ducks in a row. You want to go onto your portal and run an estimate. You want to make sure that you contact KCERA if you have additional questions, such as you want to confirm your service credit for eligibility requirements, and unanswered questions regarding the options and the temporary annuity, and then service credit purchases. So if you are in the middle of a purchase, you're going to need to make sure that that's paid before you retire, because you can't continue paying for it after retirement, so you'll need to get a payoff. And then on that purchase of service, we don't want to procrastinate. You don't want to wait until retirement and go, oh, by the way, I want to purchase that extra help, because it's going to take our staff a minimum, we do a minimum 60-day window. So, and then interest is accrued all the way up to that point. So you've got service credit to purchase, do it now rather than later. Yes, ma'am.
I have a question back to the divorce part. If you retire and then you file for divorce, how does that affect your?
Her question was, if you retire and then you divorce after you retire. Once again, your pension is still community property. So if you were married during your career where that pension was based off of, then your former spouse could be and still be entitled to community property. It's going to be dependent on those divorce documents. But once again, it would be something that you would need to contact KCERA and make sure you get us the divorce documents, preferably the draft before it goes to the court, to make sure that you're protected and that you have everything lined up the way it should be. But yes, it's still considered community property even after retirement. All right, so you want to make sure that you also decide what you're going to do with accrual balances. Vacation and comp time is paid out at 100%, and sick leave is paid at a percentage based on your years of service per your MOU. For fire, your sick leave per your MOU goes into that post-employment health plan for most of you. But definitely check with your HR department or your MOU for specifics on the payouts on your accruals. But you want to decide what you want to do with it. Do I want to do a payout or do I want to do a rollover? Well, payout, as we mentioned previously, when I was talking about doing a purchase of service using accruals, if you do a payout, the county is going to apply that supplemental tax. It's going to be about 42%. That's a hefty hit. Or you can roll it into deferred comp. Liliana is going to come in after me, and she's going to talk about deferred comp and what to do with your deferred comp account, rollovers, and stuff like that. But you can roll it into deferred comp. It is tax deferred when you roll it in. One of the things that I always tell members is if you're maxed out on your balances, look at how much it's going to calculate out to. You need to know how much you're allowed to roll into deferred comp, number one. And if your total amount of your accruals is going to max that, if it's more than the max amount that you can roll, I would consider, me personally, I would consider rolling my sick leave first, because on your vacation and comp time, you can do what they call terminal vacation. I don't like the word terminal. I always call it transitional. That's why I stutter. I want to start like a poll and get everybody to change this to transitional, please. So I'm going to call it transitional, and all of you are going to know that I'm meaning terminal vacation. So you can roll that sick leave first and roll as much of your, vacation and comp time. And that way, if you've already hit the max, you can then either do the cash out, or you can do transitional vacation and run the rest of those hours out. The great thing about the transitional vacation is you remain on county payroll. You're not having to physically be at work, but it's just like you're on regular vacation. You're running out those hours. You're getting a paycheck every 2 weeks. You're still on county health insurance. You're accruing retirement service credit. If you're close to a birthday, you can even hit, or a quarter age, you can even hit the next quarter of your age possibly. So this is a great way to use those hours as opposed to getting cashed out for them if you're not able to roll them. The transitional vacation has to be approved by your department. So you do need to speak to your payroll clerk, your department about that. KCERA does not do those calculations. I recommend you doing the calculation and figuring out when the vacation would start. Now, while you're on that transitional vacation, you're still accruing vacation and sick leave hours as well. It's just like you're on regular vacation. You just get to retire at the end of it, which is fantastic. So I would recommend calculating what you think your start date is and then go speak to your payroll clerk and work with them on that. And then one last little duck, an important one, like I mentioned, if you have reciprocity, make sure that you contact that reciprocal agency because you'll need to submit a retirement application with them using the exact same retirement date with KCERA. So that way you get those, that reciprocal benefit. You can also ask them, if you run that estimate in your portal, when you contact that reciprocal agency, you might be able to get them to provide you with an estimate of what your pension would be through deferred, through the reciprocal agency and provide them with whatever that highest monthly average salary is your estimator is providing to you. And that way you can get an idea of what your combined income would be. 6 to 8 weeks, another party. Really start planning your retirement party. 6 to 8 weeks, you're like less than 2 months. So you want to make sure that you get a retirement application packet from KCERA. You can get that off of our website. You can contact us. We can send that to you. You can come by and pick one up. In that packet, you're going to have the single page application. That's where you're going to choose your option. And you're going to also have a direct deposit agreement. There's going to be tax forms in there. And I'm going to apologize right now. We have no control over those tax forms. They can be scary, but there are examples in there. Unfortunately, we can't help you with those tax forms. You'll need to talk to your CPA or your tax preparer. But your pension is subject to federal and state taxes. Your state tax is based on the state you reside in, not the state you worked in. So if you move to Texas or Florida or somewhere where there's no state tax, you are only paying federal taxes. You will not pay out of state taxes. And KCERA will only withhold California state taxes. We don't withhold for any other state. Inside that packet, you will also have the beneficiary designation form. And then there will be an additional contact sheet. So if there's anyone that you need to contact, like the union or strata or anything like that, because as of your last county paycheck, your deductions stop. If you have a payment, a loan coming out of your paycheck to strata for a car payment or a mortgage, get that squared away from them. Get that squared away with them because it will not roll over into your retirement. And so I don't want you to have any lapse in coverage or miss a payment or anything like that. One of the things also I want to mention on the direct deposit, it is mandatory. And we require a voided check or a printout from your bank, the account verification form. You can get it even off of the bank's website, but please do not provide us with your bank statement. I don't want to know how much money you have in your bank account. So please don't provide us with a statement. We can't take that, but it has to be either a voided check or that account verification form from your bank. And on each of those pages in that packet, you want to make sure that you sign every single one of those pages. The great thing about our packets now is you can actually send that, you don't have to mail it or drop it off in person. You still can if you would like to, but we can take it through a secure email. So what we would prefer, if you want to email that packet to us, contact us, we can initiate a secure email to you. and then that way you can upload it and send it back to us via secure. So we care about your information, we take pride in making sure that it's safe, so we wanna make sure that we send you that secure email so that when you send that back to us, it's still secure. We cannot accept your application packet any sooner than 120 days prior to the retirement date, so 4 months. The only exception to this is if you're taking transitional vacation, we can actually take the application as soon as you start that vacation. So even if you're taking vacation 5 months prior to retirement, we can take that application as soon as you start the vacation. And we actually recommend submit that application like the day prior to your transitional vacation start date or right when you start it, because once you get in vacation mode, you're basically retired. You're gonna forget about us and forget about your packet and not want to answer the phone because you're gonna be on that beach enjoying retired life. So make sure you get that packet to us because we cannot backdate. So if you forget and you don't submit your application packet prior to your retirement date, that can really mess you up. So please don't do that. We do have an interactive packet online. So it's a lot easier. It'll auto-populate the redundant information. So you go out to our website and easy peasy fill that out. We need a clear legible copy of your current driver's license, current driver's license, your government issued ID, passport will even work if you don't have an ID. We do require a copy of your marriage license, not the certificate, not the foo-foo one. The only one that we would take on a certificate would be from Nevada because their license and certificate is the same. So copy of your marriage license or state registration for domestic partners if applicable, and then the divorce documents. Now, hopefully by the time you're submitting your retirement application packet, you have long submitted those divorce documents and not waiting until you're submitting your application packet, because that would be, might be a hiccup for you.
I've already submitted my divorce thing and had it with me by legal and everything.
So you're good.
So when I fill out the packet, do I have to send the thing that says you're cool, or you already have it?
So her question was, she's already gotten her divorce cleared by our legal team, and when she submits her retirement packet, does she need to send anything to us? No, you don't need to. We've already got that. When you submit your application packet, we're gonna review your information. We're gonna do a audit of your file, and we'll see that we already have that. So you're good. Once you submit your application packet, my staff will review your application and review your history. They're gonna send you what we call a retirement timeline. That timeline is gonna tell you this is your retirement date, this is when your last day on payroll is gonna be, this is when you're gonna get your last employer paycheck, this is when you're going to expect a phone call from KCERA to say, hey, we got your final papers done, because you're gonna have one more set of final papers to sign. We've got your final papers done, we're gonna contact you between this time for you to sign them. We can do that electronically for those of you who are planning to move out of state or out of town. And then it will also tell you when you'll receive your first full retirement deposit. If there's anything missing, we will also have that on that timeline. And if we find that you had a divorce in there and we don't have the documents, that will be on that timeline as well. And we will also mail you the REOKC packet. So if you mail or drop off your application packet, we will, if you drop it off or come in person, we'll provide that REOKC packet to you in person. If you mail your retirement application packet in or email it in to us via secure email, we will mail you that REOKC packet. And there's all kinds of great information in there. Anybody else have this on their wall, inside their locker, bulletin board? Yes. I don't have one of these. All right, so last but not least, make sure that you notify your department. Some people don't want to notify their, I hear some laughing. I hear you over there. Some people just want to go, see ya, I'm out the door. As fun as that would be for some of you, I understand, I totally can understand. It's not advisable. You definitely need to make sure that you give your payroll clerk at least 2 weeks notice. The reason is that we have to have the upload saying that you're retired. We have to get that information from your department. They have to do what's called a change of employee status form for most departments, for most county. And that takes you from active to retired. They have to complete that paperwork timely, get that submitted, so that way in our system, it flips you from active to retired. And then my staff is able to calculate your pension, get everything processed, do what they gotta do so that we can get you on payroll. So you definitely, don't wanna just run out the door and not say anything, give them at least a 2-week notice. Yes,
What's the lag time between, and it might vary between your last paycheck as a county employee and your pension check?
good question. So his question was, what's the lag time or the difference from the time difference from when you get your last employer paycheck to when you get the first payment from KCERA? So it can vary, it can be anywhere from 4 to 6 weeks. So KCERA pension, you're gonna go, because your employer, you're on bi-weekly. With your pension, you're gonna go monthly. And when you get your last employer paycheck, you're going to go about 4 weeks. Some of you may go 6. It just depends on what retirement date you choose and when you get that check, that last check. If your final county paycheck, let's say it was September 15th, you're going to be on KCERA's October payroll. You're going to get a retroactive payment from us around the 3rd week of October. You'll get a deposit. That will be for that partial of September that's owed to you. And then you'll turn around on the last day of October and get your first full deposit. That would be for the whole month of October. So 4 to 6 weeks it is average. And if you're not really sure and you're wanting to try to get it down close to that 4-week window as much as possible, you can always reach out to our office. You can email us and say, hey, I want to retire in November, but I want to try to get close to that 4-week window so I don't have as much of a lag time in between deposits, payments. They can tell you, if you do this date, this is when you would get paid, etc.
On COLA increases, do we just automatically see those in the pension?
Yes.
Okay.
So I'm going to go over that in a second. His question was on COLAs, and I'm going to touch on that in just a second. As I mentioned, you want to make sure that you contact your department, contact health benefits. As Jocelyn stated, at least 30 days prior, you want to make sure that you don't lose out on that if you're wanting to do county health insurance. Make sure that you contact Deferred Comp, and Lily on it is going to go over all of that with you guys today. Strata, American Fidelity, like I mentioned, it doesn't automatically roll over. The reciprocal agencies, and submit your packets timely. Few things to keep in mind, last little bit. We cannot provide you an income verification form prior to your first deposit from KCERA. So don't go out and buy a big house or a new car or a boat to enjoy retirement. Happy retirement to me. You can do it, but we cannot provide you an income verification until after you're on our payroll. So just keep that in mind. Once you get on our payroll, once you get that first deposit from us, then we can generate that for you. And then you can safely rescind your retirement up to the date prior to your retirement date. If you're doing transitional vacation, that's irrevocable. That would be between you and your department, but safely prior to the day prior to your retirement date. And then the cost of living adjustment, that is automatic. So every year, April 1st, our retirees are subject to a cost of living adjustment called COLA. And it's a maximum 2.5%. That's not a guarantee, but it has been that maximum for a handful of years at this point. And as long as you retire on or before April 1st of that year, you're going to be subject to that COLA. So if you retire March 31st, April 1st, you're picking up that 2.5% COLA, if that's what it is that year, okay? And then also there's what we call a Supplemental Retirement Benefit Reserve, SRBR. And all retirees are subject to that. And it's dependent on years and a couple other factors. When you retire, the staff will actually go over that with you show you what the amount is. And every July, there is a flat 2.5% COLA on that SRVR as well. So a couple of things to look forward to, little bumps for you guys. All right, so contact information. You can also go out to our YouTube channel and watch any of our previous videos that we've recorded. Our website, email, all of that information is on the last slide. And the QR code will take you right to our website. Yes, ma'am.
You mentioned that as an active employee, we're paid bi-weekly. You said as a retiree, it's monthly. What is that date?
Her question was the payroll, that as an active member, you guys are paid we're paid bi-weekly. When you retire, your payments are monthly. The paydays are always, and that's a great question. Paydays are always on the last business day of the month. Your deposit will go in on the last business day of the month. It may not be the exact same day every month, but it's always going to be the last business day of that month. So if the last day of the month, August 31st, and it falls on a Sunday, your payment's going to end up being deposited on Friday. But the next month, the 30th, 31st, 30th would be on a Tuesday. That's when your payment will be. So it could fluctuate. Just remember, it's always the last business day of the month. Okay. And then statements for your pension remittances. The only way that you can access those is through your portal, and your 1099s. Through your portal, you will get your 1099s about a week earlier, I think it is, right, Jeremy? About a week, Jerry? About a week, give or take. So you can get those a little bit earlier through the portal as well. So portal. Yes, ma'am.
So if you retire early due to a disability, it's pretty good 50% of your retirement.
So our question was on disability retirement. If you are granted a service-connected disability, then you are entitled to 50% of whatever your final average compensation calculates out to, and that 50% is tax exempt.
But it has to be service connected.
For the tax exempt portion, it does have to be service connected. And yeah, there's more information on basic information on disabilities out on our website. But disabilities is such a specialty for each person that if you do have a disability, that something that you are permanently incapacitated for the performance of your job duties, definitely reach out to KCERA and you can speak to one of our specialists. We are completely separate from workers' comp. So workers' comp bases the disability on a percentage, whereas KCERA, you're permanently incapacitated or you're not. It's not like a percentage, the way workers' comp works. Yes, ma'am.
You mentioned that if you purchase time, that would affect Social Security somehow, or like, does that matter for any amount of time, a large amount of time, a small amount of time? And then if so, are they gonna require documentation for that purchase?
So her question was about Social Security and purchases of service, how it could potentially change the amount that you get from Social Security. I don't know the specifics on that. That would be something you would need to, when you start drawing your file for your Social Security. I'm just giving it as a heads up that it could potentially, the purchase that you do with KCERA could potentially reduce the amount that you're going to get from Social Security. But you would want to speak to them about that. They would notify us. They would send us information for us to fill out and send back to them. But there's a whole process that they'll have you go through. Yes, ma'am.
And then, this one, I don't know if you can answer, the supplemental health benefits that was paid in, and we opt out, that money that we put in there.
So our question was on the supplemental health benefit for those of you back in the day when we had that option to waive and sign out and not have that deducted. That is all handled through health and wellness. So you'll need to actually speak to them about that and how to obtain those funds and whatnot. think there was somebody else. Yes, ma'am.
Yeah, you said that KCERA is not gonna be able to calculate the terminal vacation.
So her question was about KCERA calculating the terminal vacation, transitional vacations. Correct. We do not do that calculation. That is between you and your department. So once you decide when you're gonna start your vacation, you'll figure out where it's going to end. The date after your last day of vacation is gonna be your first day of retirement.
Thank you.
You're welcome. Yes, ma'am.
If you're of age to retire and, but you haven't completed your 10 years to be eligible for your retirement, what happens to that additional vacation and, coordinating a pay from KCERA? You know, like it's gonna be 10 years to the date, or, I mean, I don't know all that fits in together to start getting your retirement.
So her question was on not being age eligible, but not having the 10 years yet. So in order to start drawing a pension, you do have to have the 10 years eligibility, the minimum age 50. If you are able to take, if you have enough vacation that at the end of it, it's going to get you to your 10 years, then yes, because while you're on transitional vacation, you're accruing retirement service credit, just like you would if you're on regular vacation. So if you're a month shy of having your 10 years and you want to take transitional vacation and you've got, you know, more than a month of vacation or a month vacation, that will get you to that point. You just want to make sure that you calculate that out, contact our office, and my staff can definitely check those numbers for you and make sure that whatever date you're choosing is going to get you to your eligibility date. But you can also check on that on your member portal and plug that date in to the estimator, and it'll tell you if you're eligible or not.
And what if it's nowhere near?
So if you are planning to resign, then if you're vested, as long as you're vested and you have 5 years of service, then but you're not eligible to start drawing your pension yet, you can resign and leave your funds and service on deposit. You can defer your retirement to the later date when you would have been eligible to start drawing that pension had you continued working. And I think someone else. Yes, sir.
So when you opt for the cash out of your accruals, is that paid on your employment's last paycheck, or is that from a different source?
So his question was on cashing out your accruals at retirement. That is going to be on your last employer paycheck. Yeah, they'll pay that out on that last check. Welcome. Yes, sir.
To calculate that, is it just as simple as your hourly rate, times how much time you have, and that's what your total amount?
Yeah, his question was how to calculate your accrual balance with the cash out would be, and yes, it's your hourly rate calculated against your hours. And make sure that on the percentage, make sure that you're entitled to, for like the sick leave, make sure that you're entitled to that full 100% or whatever percentage you're entitled to. Don't want any surprises.
Where if you cash out vacation and sick time above a certain amount, I think they pay you half of it 1 year and half of it the next. There's some weird thing.
You would want to speak to your employer about that. I know that that's in the county handbook, but that isn't anything that we handle. We don't do the cash outs. That's all handled through your employer. So you would want to speak to your employer on that if that's something that they would even be willing to do. Anyone else? Any other questions?
Yeah, I just also got one.
Oh,
So some management have a life insurance policy through the county, and upon retirement, is that an option? Is there an option for us to continue that? Through the department to handle that, or that's something that you?
So his question was the insurance, the life insurance that the county has for the employees. That is, and whether it's available to you after you retire. Yes, it is something that you can purchase at retirement, but that's all handled through health and wellness through Jocelyn that was here. There is a time limit though from when you retire, you have to, sign up for that and get that all squared away. I want to say it's within 30 days. So I would speak to Jocelyn over at Health and Wellness and she can get you all the details on that. From what I understand, it's a pretty decent price to continue it. It may have increased since the last time I looked at it, but it seemed fairly reasonable to me. All right, anyone? Yes, ma'am.
You mentioned earlier about an SRP COLA. Can you explain that a little bit more?
SRBR, Supplemental Retiree Benefit Reserve. These are monies that were set aside for retirees. And it's based on your, there's a calculation that's done when you retire. And it's based on your years of service will come into play. And you will receive this amount every month on your paycheck, on your pension check. And so the COLA is applied in July and like it's 2.5%. It's 2% or 2.5%? It's 2.5%, right? Yeah, 2.5% flat COLA on that amount. But these are just monies that were set aside in a reserve for retirees, and you will receive that supplement, that small supplement on your pension until there's no more funds in that reserve. All right, last question, and then I'll have to hand it over to Liliana.
So the years of service for that benefit, is that based on actual years of service with Penny, or does it include time off back?
It does include some time back, if I remember correctly. His question was on the SRBR and the years of service, and off the top of my head right now, I'm drawing an absolute blank on how it's calculated, but I do believe it includes, actually, no, I don't think it includes purchase, only just redeposits, not extra help. I think it's just redeposits, if I remember correctly. All right, well, I appreciate your time. I know that was kind of long. I thank you so much.